Hi, my name is Dr. Carlos Ortiz-Ortiz. I'm a minimal invasive robotic surgeon with a subspecialty in complicated complex abdominal wall reconstruction hernias. Today I want to talk to you guys about what is actually a hernia, the symptoms, and who will benefit from surgery or not. So basically, a hernia is a defect on one of the layers of the abdominal wall of the ventral of the abdomen, which is called the fascia. That fascia, for multiple reasons, which we're going to talk about in a little while, may develop a defect, a hole, and that defect is considered a hernia. And depends on the symptoms, the size, and the type of hernia is when we surgeons recommend if the hernia should be repaired or not. Which patients are more, or which patients have more chances of developing a hernia? Well, usually hernias are, or the most common hernias are incisional hernias, in which the patient already had an incision from any other surgery. Those patients can actually develop a hernia. About 10-20% of those patients will end up with a hernia, and depends on other symptoms, it could increase up to 30-40%. A ventral hernia primary, which usually we may see it on the belly button, that's an umbilical hernia, ventral hernia. Other patients are obesity, which is one of the most common findings or reasons why we develop a hernia. Diabetic patients, patients with previous hernias or recurrent hernias, patients with connective tissue disorders can also develop multiple hernias. Depends on the patient body habitus. The hernias can be classified into different types, including, as I mentioned before, primary or ventral hernias, incisional hernias, recurrent hernias. Depend where the hernia is located. If it is located on the lateral side, we have the rectus muscle, and we have the linea semilunaris running around here, more or less. And depends where the hernia is located, we can have either flank hernias. They are common in incisional hernias where the patient had previous kidney removed. Also, espigillian hernias, which are lateral to that linea semilunaris. So there's multiple types of hernias, and there's as well multiple types of repairs that we can offer the patients for to repair the hernia. Which are the most common symptoms of a hernia? Well, usually the most common symptom is a bulging. Patient will see actually a bulging, and that's how the patient usually entertain the idea that they actually have a hernia. Also, other symptoms are discomfort, pain. Sometimes the hernia can actually cause a bowel obstruction, in which an incarceration and a bowel obstruction, in which the patients actually abdomen get distended, they start throwing up. And those patients specifically with an incarceration and a bowel obstruction will require urgent and or emergent surgery, depending on the symptoms. Now, who will benefit from a hernia surgery? Well, there's different type of surgical schools, in which some surgeons will, depends on the size of the hernia and symptoms, may tell the patients, well, let's watch that hernia, let's not do surgery for now. But if the hernia is already symptomatic, meaning that the patient is having pain, discomfort, a bulging, and or if the hernia is an incisional hernia, which is caused by a prior incision, and or recurrent hernia, which is a hernia that actually was repaired before and it came back, those hernias should be repaired, usually if the patient is a surgical candidate. So in those patients specifically, we should offer surgical repair if at all possible. Now, as I mentioned before, there's multiple types of hernia surgeries. We have open hernia surgery, in which we do an open incision. We have laparoscopic surgery or minimal invasive surgery, in which we have laparoscopic and robotic surgery. Which is the difference between the three of them? Well, laparoscopic and robotic hernias, we can put them in one group, which are minimal invasive, and open hernias, which are the traditional big incision, depend on how big the hernia is. These kind of hernias, or actually the ventral hernias, we, if at all possible, we try to repair them minimally invasive, meaning through small incisions if at all possible. Why? Because the patients will have a faster recovery time, less complications, less wound complications, which we're gonna talk about in a minute, as well as we'll go back to work sooner. Now, the difference between laparoscopically and robotically is that robotically we actually use a machine, the robot, which has more, which enable us to have a better visualization and no tremor. Meaning that depends on the size of the hernia and the type of the hernia, we can actually repair it robotically, when before we were not able to repair it laparoscopically. So basically the robot gave us the advantage of repairing, fixing that hernia, or a bigger size of a hernia or a more complicated hernia through the small incisions than before, in which laparoscopically was either extremely difficult or not possible, depend on the surgeon experience and expertise. Now, open hernia, we still do open hernias, either a small tiny umbilical hernias that we can actually repair open with the small incisions, and or extreme big large mega hernias, which is basically one of my specializations. We have the abdominal water construction hernia program at Celebration Hospital, which I'm the director. I trained for this specifically for 2 extra years to be able to offer this kind of repairs to these complicated patients. Open surgery versus minimally invasive surgery, we have different type of surgeries that we can actually offer as well to the patient. Open surgery, we can offer multiple ways in which the hernia is repaired, as well as if we need a mesh, which we're gonna talk about in a minute, we can place that mesh in different layers, as well as robotically or laparoscopically, in which we have different kind of repairs, either IPON, IPON Plus, TARS, preperitoneal retrorectus repairs, which are different type of repairs that your surgeon, if you have a hernia and you look for a surgeon, should know, should be an expert and should be able to offer these multiple options or multiple repairs. Depends on the size, once again, and the condition of the patient. But as a patient, you have to make sure that your surgeon is capable of repair this hernia in these multiple ways, so he can actually or she can actually offer you the best possible outcome. Now, it's very important because I see a lot of patients in my office in which their BMI or is extremely high, meaning that they are morbidly obese, and this is a conversation that we need to have with our patients. Patients morbidly obese and diabetic smokers are patients that will have a higher complication rate and a higher chances of the hernia coming back if we repair or fix the hernia. So those patients, we actually have a program at Celebration Hospital in which we offer them a full team in which we help them either lose weight, control the diabetes, stop smoking, for the surgery to be successful. Some patients, morbidly obese, will benefit actually from bariatric surgery before the hernia is repaired. Why? Because once again, we know that the higher the weight, or the BMI, which is a measurement that we actually use between height and weight, the higher it is, the higher the chances of the patient developing a complication. And in open hernia surgery, those complications can go up to 50%, depending if the patient is obese, diabetic, and a smoker. Smoking is extremely important. Those patients, we should not repair the hernia until they actually stop smoking, because the chances of developing a complication is extremely high, including wound dehiscence, which is when the wound actually opens up by itself, and or a wound infection or mesh infection. Now, talking a little bit about mesh, it seems very important that your surgeon actually recognize that there's multiple mesh in the market, and there's multiple ways to actually place that mesh inside the abdominal cavity. It's extremely important that the surgeon actually has an expertise in that specific, because otherwise that surgeon should not be conducting hernia surgery, will not be able to provide you with the best possible outcome. So talking about mesh, we hear a lot of patients coming to our office complaining, or actually not complaining, asking about lawsuits. We turn on the TV or the radio and we hear or see someone talking about possible lawsuit. We have to understand that the chances of something going wrong with the mesh is extremely minimal. And if something goes wrong, it's usually because something went wrong either during the surgery or after the surgery. Usually it's not related because or related from the mesh. Yes, some patients, they may develop a complication, a mesh infection, chronic abdominal pain. That may happen from any kind of surgery, and that may happen with any type of mesh. Once again, chances are extremely minimal. The advances that we already have in technology from 20, 30, 40 years ago allow us to use mesh safely. Patients with defects over 3 centimeters, should actually have a mesh placed to reinforce that closure. Otherwise, the chances of the hernia coming back is extremely high. So between that, the patient and the type of hernia is how we determine if the patient will benefit from surgery, and or if we can actually wait, or if something else needs to be done before the hernia is repaired. There's multiple, as I said, there's multiple type of hernias, including inguinal hernias and ventral hernias. Inguinal hernias are hernias at the groin region, which are treated completely differently, but the surgeon should actually be able to offer the patient as well laparoscopic versus open approach. And if they're not capable of offering either one or the other, then those patients should actually look for a second opinion to once again have the best outcomes. Once again, my name is Dr. Carlos Ortiz. I'm extremely happy about talking about this conversation that we already have today. June is the month of hernia awareness. This is why I recorded this video. I hope that you guys actually like it, enjoy it. If you have any questions, feel free to join me or call my office. We are located at Celebration 410 Celebration Place, Suite 302. If you're gonna reach me at some point, we're gonna give you a call back. Once again, any questions or any comments, you guys can feel free to call us. Thank you and have a blessed day.